had regular mammograms. I didn't notice any changes in my breast or anything. I didn't feel anything, but I had a mammogram come back with some questions, and so I went back to have another one, and they found something. So then I went and had a biopsy, and it was cancer, but it was very, very small. So I went to see Dr. Weaver, and his impression initially was that it was going to be something very small and very simple. When I got the cancer, I wasn't really all that surprised because so many other people that I know have cancer, people who I thought were very healthy, and so it was kind of like, well, I guess it's my turn. And you know, I think I was more upset about how my husband would deal with it, you know, because I knew that he, you know, really loved me, and so I was more sad for him. We decided to go ahead and have a PET scan done. My husband and I asked if we could have a PET scan done based on some experiences our friends had had. We found out when I was in the hospital, having to have my port placed and to have my lymph node biopsy. The doctor came in and told me, oh, we got your PET scan results back and it's in your liver. So what looked like it was a very simple thing turned out to be stage 4 cancer, and it was HER2 positive. So we talked to Dr. Weaver, and he told us about how he would treat it. And I thought, just to do due diligence, I should go and get a second opinion. So we went to another local place, and the feeling that I got from that place was very, very impersonal. I just felt like Dr. Weaver considered me as a person instead of just a number or a diagnosis. And he was very matter-of-fact and very kind, and so we just decided to go with him. He has a very calming manner about him. He's very warm. He always hugged me when I was leaving the office. He always seemed genuinely happy whenever I got any good results from my treatment. He spends as much time as we need when we're on our appointments with him. My husband always has a lot of questions, and Dr. Weaver is, you know, very happy to answer any questions we have. And I think it's mostly that he treated me like a person. You just feel like you're in good hands with him. He doesn't seem like a cold clinical doctor, and that was the feeling I got at the other place. And we don't always talk about the medical aspects of my treatment. Dr. Weaver is always telling us about, you know, things that he's been doing, and we discuss things that we've been doing. And I think he's just happy to see that I'm living a full life with stage 4 cancer, you know. And as I say, so far, all of my results have been very, very good. So we love him.